Hello, I'm Caloris. I'm your nurse today, and I would like to do a respiratory assessment on you. Is that okay? Okay. All right, well, thank you. So what I'm going to do is I'm going to go ahead and I've provided the privacy for the patient. I'm going to go ahead and I'm going to sanitize my hands. Okay, and get that good and dry. I would like to check your ID. Could you give me your name and date of birth? Okay, so thank you for that. Do you have any allergies? Okay, so with the respiratory assessment, I'm going to be asking you, a few questions, and then I'm going to also be checking you out as well. Listening to you, making sure you're breathing all right and all that. Okay, so do you smoke? Okay, all right, well, thank you for that. How about, have you had any call for any type of in respiratory illnesses lately? Okay, what about the environment as far as like where you work at? Okay. Does anyone in your family have like any respiratory problems or illnesses? Okay. All right. Do you take any medication or anything? Okay, well then that's okay. I thank you for that. So what I've done, I've assessed while I'm talking to her, I'm looking and I've assessed her level of consciousness. Okay. I see that she's not in any type of distress as she's talking to me and answering my questions. At the same time, I'm still going to go ahead and I would check her respirations. And that's exactly what I'm doing. Okay, so you would assess that for a full minute. Okay, I'm looking at her around her mouth. I'm making sure that there is no cyanosis or anything. I want to look at her hands, checking checking to see if like we can do a capillary refill right while I'm doing that. So that's what I'm going to do. I would also check her pulse ox. Put the pulse ox right on her finger and let that read that. I'm looking at her face. Are you having any pain? Okay, good. Let me know if you have any pain or if anything that I'm doing is if it's tender. I want you to let me know. I would also be checking her feet. I'm comparing them. I'm checking her pulses. Okay, I'm checking the temperature, making sure that everything is all right, that there is no edema. I'm looking at her skin, just, an overall of all of that. Okay, so with that, and I don't notice any clubbing. So I'm gonna go ahead and start palpating. So like I said, if anything is tender or if there's pain, I want you to let me know. So what I'm doing is I'm just gonna go right on. I'm checking for any masses, any crepitus. And there's the wing, okay. And then I wanna, I'm just checking to make sure how you breathe, and then we're making sure that that it's even. Okay, and I thank you for that. So then I would go right on ahead and I'm gonna do her front and then I'm gonna do the posterior. So I'm gonna go ahead and I'm gonna go ahead and listen to her. So I'm gonna get my stethoscope, and right above the clavicle is where I wanna start. Okay. And we're gonna go down to the second bib here, and then we're gonna listen. Okay, so now that I've done the front, I'm gonna turn right around and I would like to listen to the back of her. So, because you want the patient either sitting up when you can do this, or if they're not able to sit up when you're listening to them, they can lay to the side. Okay. So now I've got the back of her, and what I'm gonna do is, again, I'm gonna palpate. I want to make sure, again, let me know if anything is tender, okay? Or any pain. So no pain. Okay, so I've palpated. I want to check. Okay, so then I have my thumbs here. And as she breathes, you know, my thumbs are going to separate as she's breathing, you know, come together, and then there we go. And that's how that would be. So then I'm going to take my stethoscope. Again, we're going to start right at here. Okay. So then we're going to, and you want to listen to the full inspiration here. Now, if I needed to want to get the side, I would ask them, you know, if they are able to raise their arm or if they could put it across like that, and you want to get the right landmark so that you can listen to each side as well. So you want to get it even right there with the middle of the axillary is how I do it. And then you want to the side, okay. And then you would do the same thing on the other side. Have the patient, okay, there we go. Turn around over there to the side here. And then you would listen. And then I would thank you for tolerating me doing that. Then I'm going to go ahead and sanitize my hands. The doctor, you know, will be in shortly to see you, and I would go ahead and document my findings. Thank you.